I'm now joined by Thomas Knoll to talk about the EAU guidelines. Thomas, welcome.
Thank you very much.
Thank you very much indeed for taking the time to come and talk to us.
My pleasure.
Now, everybody at this conference has been talking to me about the guidelines and how important the guidelines are. So why are the guidelines so important?
Yeah, well, the guidelines are important, and it's very impressive when I'm traveling around the world that even if you come to Asia or Southern America, people show our European guidelines, and we got download statistics showing that our guidelines indeed are downloaded and read all over the world. I think the EAU very much professionalized the concept how our guidelines are developed, updated, distributed. Currently we have a guidelines office board consisting of 6 members. 160 clinicians are involved in the guidelines process. And I really think there is only the EAU in the world offering a complete set of guidelines which really covers all aspects of urology.
But why, from a clinical perspective, is it important to urologists to have all these guidelines?
I mean, the guidelines are kind of a reference. So if I'm thinking about a procedure or just an aspect like antibiotic prophylaxis, every hospital, every urologist has kind of its own standard, but sometimes it's really important to get an idea, especially an updated actual idea, what is recommended, what guides me. Of course, I can choose a different way in an individual situation, but the updated guideline is a much better reference than a book which is, well, published 10 years ago. Yeah.
What steps has the EAU been taking to improve the quality of the guidelines?
I think there were major steps, and so last year one very important step and decision we made is to further professionalize the guidelines, which means that all panels started to do systematic reviews, and I'm responsible in the guidelines office board for recruitment and guidance of associates. Associates mean usually younger urologists who are trained how to do a systematic review by colleagues from Aberdeen, and they do together with the distinct panels systematic reviews, and they try to answer open questions for the distinct fields. And so what we really try to is to involve the younger generation at an earlier stage, because they become, well, the next important generation in the EAU, and we try to have them at an early stage to train them and to bring them in a position where they can train the next generation again.
How important is it globally? How important are these guidelines globally?
It rarely happens that somebody shows a talk on a clinical question, and he's not showing at the beginning some slides of the EAU guidelines. So I really believe, and as I said, we have data to support this, that we are the #1 meanwhile worldwide.
Well, Thomas, thank you ever so much for joining us. Really appreciate it. Thank you very much.